why do I know about this stuff? And like, how did I get this knowledge and where did I get it from? And it was one of those moments where I realized like, oh, okay, maybe I am in the wrong crowd. The highest score you can get is satisfactory. And I think that kind of sums up the feeling of a lot of doctors is like the best you can do is pass and then on your way. If you can drop the mask completely and take the fear and be like, right, I'm going to be bold. I'm just going to be myself. I'm going to be honest. I'm going to say what I think. I'm going to pursue what I actually care about and not thinking.
Hello and welcome to Get a Shift On, podcast all about healthcare career change, financial reality and planning your final shift properly. Today, I'm super excited to welcome Dr. Luke Mitchell, a former doctor who stepped away from clinical work and now works as a financial planner. He brings perspective to this conversation that most people miss and actually that we really need to talk about, where we're looking at financial sense as you make that change from healthcare.
Thank you for having me.
That's a real pleasure. We met on LinkedIn and I was really taken with your profile because obviously I work a lot with healthcare professionals who change career and move into something different. Can you, just for my listeners and viewers, explain your journey on that from the medical world, from healthcare to financial planning?
Yeah, of course. So I spent 6 years in the NHS working as a doctor. So for those that know the space, I did my F1, F2 here in Sheffield and Rotherham, and then spent a few years locuming because my last placement was on critical care in the very beginning of the pandemic. So that was quite an experience. And at that point, I wanted to go into anesthetics and critical care. And I think that experience, although the placement itself was amazingly well supported, it made me question whether I actually wanted to do that job, looking at the lives of the consultants. So I didn't know what I wanted to do. Spent some years locuming, mainly in COVID wards in Chesterfield mostly. And then when my son was born, it was the first kind of big disruption to my life and made me question what I was doing and trying to balance being two working parents with a young child. And that was kind of the decision point for me where I was like, I don't want to be doing nights and weekends forever. I actually want to be able to be at home. And the level of stress in the job was taking its toll at home. So I sort of thought, okay, let's step away from that. I'm going to go and try and be a GP. And if I don't love it, I'm going to quit. So I kind of knew in advance that this was kind of the last chance saloon for my medical career. Got into GP and was doing well, progressing, finished my first year. And then it was when my daughter was born, that was the second sort of decision point where I thought, maybe it's not about the nights and weekends, maybe it's something a bit more deeper. So I decided I wanted to do something else with my life, which was a slow, gradual decision. It didn't happen all of a sudden, and spent some time doing values work, which we'll talk about, I hope, because it's so important. And then realized that my interests weren't in medicine and probably never really were. Even though I did the job well and I was committed and always had good feedback, it just wasn't where my interests were. And one moment for me that was quite key was we were in a GP training seminar, and it was near the end. We were just sort of chatting. It was winding up and someone mentioned the strikes and we were talking around that topic, and someone asked me what I thought. And I just went on this 10-minute rant about modern monetary theory and inflationary economics and central banking and fractional reserve banking. And everyone was very interested, but also very confused as to like, why do I know about this stuff? And like, how did I get this knowledge and where did I get it from? And it was one of those moments where I realized like, oh, okay, maybe I am in the wrong crowd. Not that, there's anything wrong with the people in medicine. There isn't at all. It's just, where is my fit? So I kind of used that as a signal and spent some time with a good family friend who's a financial planner down south. And I went to see him. And as soon as I saw him do the meetings, I was like, yeah, that's what I want. This is what I've been hoping GP was. I was hoping that sort of long-term relationship, and saw them chatting for an hour, 2 hours at times, and thought, yeah, immediately thought, yeah, that's it. That's what I want to spend the rest of my life doing. So I said, what do I need to do next? And he said, go get your exams. I started doing those and then was doing some part-time work around it, and then joined Quilter in their academy last April. And now I'm finally launched and run my own financial planning business, which is focused on doctors mainly. So that's the slightly long-winded version.
Not at all. I think that's probably quite a speedy flick through, really. But in that, wow, so much to unpack and talk about. And I think a lot of what you've mentioned there, people will be listening and thinking, that sounds so familiar. From being in a job that, although you're very good at it and you like, just doesn't feel right. Children, you know, often there are people who have that, I guess, aha moment, and children seem to be a big factor in that. Certainly was for me. That's when I think I realized that, yeah, I don't really want to be on the road all the time doing what I was doing. So yeah, I think it's so important here. So I want to take a few steps back, and let's start again right at the beginning. What made you go into medicine in the first place?
It's a good question, and one that I kind of reflected on a lot at the beginning of this journey away, because I think sometimes you kind of forget, unless you've got a really, like, I know some people where it's like that's their calling and it always has been.
Absolutely. Yeah.
I remember speaking to someone recently saying that they never felt like a medic-y medic. And I think that was very much my experience as well. And so you make the decision when you're in you're a teenager. And really it was that I was doing well in school, and the school and those around me were saying, these are kind of the selection of things that people generally do when they do well in school, doctor, lawyer, engineer. And
Yeah.
of those three, medicine was the best fit. And I was, yeah, my whole family has a sort of healthcare background. So now my sister's an OT, my other sister is a midwife, my mum's a physio, my wife's a nurse. Like there's healthcare's kind of been in
It's
my
strong.
family. Yeah. And so it was like, well, you're doing well in school and healthcare's our thing. So go and be a doctor. And I sort of did a bit of work experience and thought, yeah, this seems like cool. It looks like a challenge. I'm up for a challenge. May as well give it a go. And as many of us know, as soon as you get into med school, you're on a very rigid step by step track all the way through to CCT. So I think I committed and did what I needed to and passed everything first time and went through the whole thing, but there wasn't much time to stop and question the why along the way.
I think that's interesting, isn't it? Because so many people find themselves doing something because of family, because it's where you feel that you should be going. And it's, I guess, in many respects, an easy route because it's familiar within that kind of family. And also, and I know we talked about it offline as well, but when you're offered such a narrowed career path, because you're very academic or you've got these traits, yes, definitely lawyer, doctor, engineer, which is great. Thank goodness we have all of those careers, but it's very narrow. And I think we're of an age where we're done and dusted with that. But for our children, especially yours, who are younger than mine, by the time they come to pick their careers, I hope, really, really hope that there is a different attitude towards it. And that's not just to do with AI and the amazing work that happens there, but it's so narrow-minded to think that there's only set careers and you must go to university, you must have this education. Because what it leads to is, like you said, you're a non-medic medic where you in a job, which it's a job, it's all right, but there's something again that just is not quite right. And it must be so hard when you're planning, and you talked about COVID and being on those wards, and that must have been such an incredibly tough time for you
Mm.
and everyone else work. Do you think that has affected a lot of people, and especially with career choices moving forward?
The COVID period
Yeah.
specifically. Yeah, I think so. Yeah, I mean, it was an unprecedented experience. And I think the the overall morale in the NHS has been declining for a while. I remember being a few years into med school and the first strikes happened in, I think it was 2016. And so that was kind of the culture that I was entering into. And then, I've been qualified, a year and a half, and then this pandemic happens and I think things happened in that time that both patients, family, and staff wished never happened and wish they'd never seen. And certainly that's true for me. And I think there wasn't the debrief or the support there that perhaps was necessary for the level of stress and at times horror that people were experiencing.
Yeah. Yeah.
So yeah, I think it leaves its mark. I think if the NHS had recovered in some sense from it, then maybe it wouldn't have had such a lasting impact. But I think in some ways there was damage done that's not really been repaired. Yeah. So, and I think what is most striking is it seems that the doctors much younger than me, those that are just graduating, are leaving in much higher numbers than ever before. And I think that's because they were learning the ropes during those times.
Yeah.
So, yeah. So I think, yes, in short.
Yeah. Such a hard time. And I think unfathomable for those of us that weren't working clinically during what was clearly the most horrendous time. It was bad enough on the outside, I think, for many people looking back in. And I think it really shows how uncaring a caring profession can be. And it is something I hear time and time again. And I don't want to get into bashing the NHS. At the point of care, we have a fantastic system in this country that works. But actually, healthcare and the healthcare system as a whole globally is broken for lots of reasons. And I think there's an awful lot of work to do. We can have a whole nother conversation about strikes and global healthcare systems. But let's move on from that before we get bogged down in that. But I think it's important for people to understand how influential something like COVID was in changing the future of the healthcare system in this country and, as again, I say, kind of globally. I want to go back as well. You talked about skills and you did a values and skills kind of workshop, which obviously very much interests me, because for me, I think that is the first step of any career change, is understanding what you can offer as you move forward. And especially when you come from healthcare where, and you touched on it, you have status. People know you're a doctor. What do you do? I'm a doctor. I mean, it's very pigeonholed by those career titles. But when someone says, okay, so what do you actually do? You go, patients, a bit of paperwork. So I think you have to really delve into it. So can you explain the process that you went through to unpack some of those skills that you had, but maybe had forgotten along the way?
Yeah, I think it is such an important step. I think the first thing to say for my experience was that I think in the NHS and as a junior doctor, you don't feel valued at all. That was my experience because it's all very transactional. You're going from one placement to the next, like 4 months, 6 months maximum. You don't get to know people very well. You don't get to know the patients very well in that area. And there's like a psychological theory, which I can't remember the name of, but there's 3 components of it. In order to feel fulfilled, you need autonomy, mastery, and connectedness. And if you think of the way junior doctor training is structured, because you're constantly moving on, you don't get time to get good at the job because you move on just as you get the hang of it. You don't get time to get to know people because you move on as soon as you get to know them. And you also don't really have any choice or very minimal choice over what jobs you do and how long you're there for. So I think it's really important to recognize that when people are thinking of leaving, is they're probably in a very demoralized state as a default. And I speak for myself, but also as junior doctors generally, that it's very difficult to see your own value and your own worth when you're in that state. And you're kind of institutionalized in a particular way where you don't really see your value, even in your job. And the feedback isn't fantastic because, like, I remember in order to pass your foundation years, there's a tier system and there's like basically poor, like woefully inadequate. And then like you're pretty much there. But the highest score you can get is satisfactory. And I think that kind of sums up the feeling of a lot of doctors is like the best you can do is pass and then on your way. So in terms of the values work, the first hurdle to overcome was kind of the idea that you are valuable and that you do have something to offer. And that starts with realizing the value you add to that job. So even as a doctor, it's like thinking, gosh, okay, what do I do on a daily basis? And how I'm speaking to complete strangers, building rapport with them, talking about some of the most difficult things in their lives in a way that they feel safe to divulge that. I'm trying to get important information out of someone whilst keeping the conversation human and not making them feel uncomfortable. Then I'm synthesizing data and trying to work out what additional information I need to gather. You're ordering tests to try and complete a picture. You're thinking about other things like blood tests and scans and going through their old medical history and looking through the records. And you're communicating those complex topics to both the patient, but also to your senior doctors above you. And handing over, you're speaking to other doctors at the same level of you. And there's so many skills that we are using all the time that are so helpful to any other profession, whatever you go into. So I think it took me a while to realize that to begin with. And then doing the values work, I used like a few books. I think one of them was Squiggly Career and the other one was Think Big. And it just happened to come up on a podcast and they have like workbooks in there. And some of the questions were, for example, what is it about your job at the moment that you really like? What is it about it that you really don't? And I've still got the old Google Docs of like these long lists of positives and negatives and the things that I enjoyed. And I think sometimes it's actually so important to just sit down and take that time to question that and evaluate why have I stayed in this for so long, and what is it about it that's kept me here, and what is it that's drawing me away? Because it's only till then that you're finding your north of like, this is what I care about, this is what I want to do, this is what I could see myself spending all day on. And that, until you get that, you don't know what direction to aim at. So that was my experience of working out how do I pick next. And as we were saying earlier, it took me a long time to be able to answer the question of what I want, because it isn't relevant. It isn't relevant for so long. And so you don't ask yourself the question. So I think if there's one thing I could communicate to people, especially junior doctors, is it's okay to feel like that at the start. Like that's normal to be like, I don't know what I'm here for. I don't know what I'm supposed to do, because you've not been taught to, and it's not been a priority. So yeah.
I think I'm reeling a little bit from the fact that the best you can ever be is satisfactory.
Yeah, it was nice.
That's, yeah, way to go. Thanks for everything. Very mediocre the whole way through.
Yeah.
Yeah, it's, well, again, we won't go into a system that's broken. But it's so interesting to hear you talk about understanding what you want. Because you're right. You said that, you picked at the age of 14 what to do. And it's a ridiculous age to ask anybody, what is it that you want to do? And we talked about that offline. But actually, that carries on. And once you get into something, like you said, for those junior doctors, you're thrown into a process where it's constant learn, do, carry on. This is what you're doing. And it just gets narrower and narrower. Then you start to feel overwhelmed and stuck. And suddenly all the skills that you've learned along the way, you forget. Because you're so busy doing, like you said, no one ever says, Luke, just sit down for half a day, just stop and think about what you want, what you need to do, and how can you move forward with this? Is this the right path for you? And I think there's so many reasons for that. But clearly, no institution, healthcare or otherwise, is ever going to say, do you want to leave? Thanks for all the hard work. Thanks for all the training we've given you. But, would you like to go and do something else? And then there's the internal bit where you feel guilty. You spent so much time training, thrown all this money at it, and you must question whether it's the right thing to do to leave. How did you get over that hump of when it actually came to leaving all of it behind?
I wish I could say it was like a positive decision, but I think, to be honest, it just got to the point where I was so miserable in the job that I didn't see it as an option anymore. That I was just thought, I'm not the person I want to be at home. That was the main concern, but it also started to bleed into my practice. And I thought, as soon as I saw that happening, I was like, this isn't what I want to be like. This isn't what I came here to do. I'm not gonna compromise on my integrity and my values in order to stay in this job. And it was just that moment of that I can't do this anymore if I'm going to maintain who I am as a person. And you know, you have to flex to a certain degree in every role. I think it just got to the stage where there was so much was being asked of me to bend, and that it got to the point where it was getting close to breaking. I thought, no, this is the cost is too high personally, that I'm not willing to carry on. So I think it was less about the guilt and more it was kind of like a survival decision. But yeah, people certainly do feel that, like, oh my goodness, it's the NHS, it's a national institution, it's, you know, something that we're really proud of. But it'll only continue if the staff are healthy and able to carry it on.
And you touch on a really important point there is it will continue. It is a big institution. And as harsh as I think it sometimes sounds, you are only one part of a huge machine. And the guilt comes from thinking that you are leaving a sinking ship. And with the best will in the world, I have yet to meet any singular person that is going to save the institution. And I'm so pleased to hear that you managed to get out before that massive drop or falling off a cliff, because so many people don't. And then they're forced out. And that's actually a much harder situation when you are willingly and actively able to pursue something you want to do next. It's a much happier place than being forced, because options then become limited because you feel so bad about it. So I'm so pleased that you've managed to do that consciously. And obviously moving into the financial planning sector has been a great eye opener for you, and, you know, starting your own business. And I want to talk now about that change, about that shift, and how you've actually gone through it. Did you ever imagine back when you were still a medic that this is what you would be doing?
No, no, not at all. No, it was kind of at the point that I made the decision that that was when this new reality formed. But yeah, I couldn't have predicted I'd be on a podcast, couldn't predicted I'd be starting my own business. No, none of it was predictable. But I think that's part of the fun, the
Yeah,
uncertainty.
yeah, absolutely. And that's really a very good point for people to understand, is that there is actually a lot of fun from a bit of that uncertainty. And once you escape whatever career you are in, suddenly everything opens up and you realize that there is more to it. There is fun to be had because you're not constrained. I think anyone in a job, and let's be honest, thank goodness people stay in the 9 to 5, but you are constrained. So as soon as you come away from it, you have this. And I always think it's almost eye-opening. It's a bit like the Matrix, you know, at the end of the Matrix, where he suddenly sees all the green coming down and it starts to make pictures of actual people. And that's the clarity you get. But you have to go through the process in order to get there. How did you find the courses to do for the financial planning? Or was it just a very set path to get those exams to end up where you needed to be? Anyway. Obviously, you had to take specific exams for the financial planning course. Where did you find the information to start those exams? And are there specific exams that people would need to take to get to financial planning?
I'll answer the second one first. So yes,
Yeah.
there's a little bit of choice around that. So there's a few governing bodies that provide the exams necessary to do the diploma. So I chose the CII, so that's the Chartered Insurance Institute, and they provide 6 exams, which are affectionately known as the ROs because that's the code that comes before each of them. So it's RO1 through to RO6, and each of them covers a separate aspect of financial planning. And once you've done all 6 of them, you hold the diploma. And so then you're qualified to do the job. The next process is getting authorized with the FCA and finding a firm that will appoint you, or you can become directly authorized out of the gate, which is a whole different thing. How did I find out about them was from the family friend who I went to observe. So at the end of the work experience, I said, I think I'm going to do this. And he was like, you'll be great at it. I'm pleased to hear it. This is what you need to do. Go and start doing your ROs. And I was like, well, okay, what are they? And he explained them, what they were and how to get them. So, um, yeah, you can take them whenever you want, pretty much, with the exception of RO6. So they're multiple choice. You pay upfront for the exam ticket and the coursework. Textbook, it's not coursework. So then you read it at your own pace and take the exam when you want. It can be completely remote, and you can take it at 3 o'clock in the morning if you wanted to. There's so much choice in terms of flexibility. So I did those, got 3 of them done, and then got the place with Quilter and started doing some extras. So like mortgage exams and long-term care. So there's a lot of choice of additional exams you can take. But I found that I really, really enjoyed them. And coming from obviously a academic / medical background, I'd done a lot of exams in my life, and whether postgraduate or otherwise. So I was used to it. I knew what the pace is like. I know how to take exams whilst working. And I just really enjoyed the topic. And I think, if anything, it was more of a confirmation to me that this was the right direction, because I did the first one and thought, okay, I'm actually interested in this. I'm enjoying learning about it. And that was a very novel experience for me to be studying and enjoying it.
Yeah, it will make a real change to people when you're doing something that you actually enjoy, not the exams that you're kind of forced to go through. Were you still working as a doctor when you were taking these? Or you had actually
No,
finished by that point?
yeah, no, sorry. I kind of did a hard stop. So I left in August 24 and fortunately had a part-time job lined up, which I managed to find through my mother-in-law. So thanks to her. So that kind of was the bridge that helped me study part-time, work part-time until I joined Quilter. And then it's kind of full-time study.
I'm glad I asked that question, actually, because I think it's really important for people to understand that you can have a hard stop. You'll always find something else. You're qualified as a doctor. There are always people privately looking for medics to do something else. And to have that 50-50 balance, or whatever the split needs to be, to allow you to carry on financially, which we will come back to, because obviously we want to talk about finances, is so important. You don't have to just stop and then have nothing else. There's different ways of doing it, but I think to have that makes so much difference, and it's much easier because you're not then stressed about the money that comes with it. So yeah, studying with all those exams, I'm sure, was just, just a continuation really of what you'd been doing previously.
Yeah.
I want to go back, and I picked up, you said about work experience, and I know you mentioned it earlier, and I think that's a really fascinating phrase for adults,
Yeah.
because we do work experience as teenagers or young adults. It very rarely gets spoken about for adults in career transition, which I think is crazy. And I don't know if that's because, do we feel ashamed that we're doing work experience? That's for school kids.
Yeah.
And do employers offer work experience to adults? What does it feel like to go into maybe if you wanted to go to an office, if that's what you wanted to do, and say, oh, would you mind if I came in for a week or so to do work experience? I don't know. I think there's a bit of a stigma around it, which is such a shame because it doesn't help when people want to move forward with their careers. How did you find it? I know it's a family friend, so it's probably a little bit different. But what are your thoughts on that?
Yeah, it's something I've commented on in the past as well. It's that it sounds odd when I say it out loud, like, oh, I was a 29-year-old doing work experience. It's like, that is odd when you say it out loud. But I think if you can, it's really worth doing because, there aren't really many other ways to really get an idea of what that job is going to look like. And for me, it was so important to see the job done. It was like that light bulb moment, seeing that first client meeting and going, that's it. And it might be the opposite effect. It might be you see it and go, "Wah, that is not what I thought it was. I'm not interested." But that's still a signal to follow, and it teaches you something. So I think, yeah, if you can find the opportunity and find someone who's willing to facilitate it, then I think it's well worth trying. And I think just trying to build that trust with someone else. And there might be people in your network that, like, I think what I'm surprised most about leaving and the networking side of things is how quickly opportunities come up and how close those connections can produce opportunities out of nowhere that you would never have known about. So yeah, I think ask around. There's always going to be someone that knows someone who knows someone who does the job you're interested in. And probably starting within your own network because the trust is there.
Yeah, absolutely. And I've seen you post actually a few times on LinkedIn around networking
Yeah.
and how uncomfortable it is actually healthcare is all about networking. Certainly within the hospital environment, there's so many different people you have to find with, you know, befriend almost to help you with the work that you want to do. If you're ordering tests, speech to radiology, actually what you're doing is making those connections. So when you call up and go, oh, Dave, radiographer, right. Do you mind if, can I put this CT through? What can you do me a favor? And I think that translates when you come out. But again, it's like those skills that you have. You forget it's actually what you do. It's just in a
Mm.
diff environment. And
Yeah.
networking, when you come out, as you say, is so important. And finding those opportunities, and people are willing to help. What networking events have you been to, and what's been the most eye-opening thing from them?
I'm just want to pick up on a thread that you said there because I think it's really, really important. Is that we are networking like in a hospital already, and I think that is so true that you call a certain radiologist and you're going to get a certain kind of response to another one, or even microbiology. Everyone has a reputation in a hospital, and those things carry and spread. So it's just labeled differently, isn't it? I think it's not, no one says this is what networking is. And I think also as a non-medicy medic, I didn't have the desire or drive to make additional connections to help me in my career. But when I reflect on those who are like all in, that's exactly what they were doing. They were like, oh, I need to meet this professor and I need to make friends with that professor and this doctor, because they're trying to build towards a goal of like, oh, I want to get published or whatever. So to answer your question, what ones have I done? Well, I joined Sheffield Business Runners, which is a club that's been going for a couple of years now, which is what it sounds, a running club for people in business. So it's kind of part run club, part networking event. And that's been amazing. Met so many people that way. And it's just great to have friendship and great to learn from other people who have done what you've done. And in many cases are much further along the line than you. So they've got lots of wisdom to impart. And again, as you say, people are really willing to help, especially when you're early, because they did it. They know what it's like to start from scratch, and they know what it felt like to get help back in their early days. And actually, I find, contrary to maybe what some people might think, that business has been a really positive, generous space. And especially in financial planning, that the amount of people I've reached out to and asked for help or a discussion or just like, tell me what it's like. Do you have any tips? I've spent hours and hours and hours with tens of people in the last year who have just been willing to say, yeah, sure, let's chat. I've always approached it with the attitude that nobody owes me anything, and that if I get something, anything, a chat, a message, reply, whatever it is, that's something I wasn't owed, and I should be grateful for it. And I always try and take that attitude of gratitude into those conversations and those requests. Try and put my ego to the side and go like, some people won't reply, and to be honest, almost everybody does. And so that's the LinkedIn side of thing has been really important for me. So there's the in-person stuff through Sheffield Business Runners, and they run a lot of events, and there's a lot of events that people within that group go to, which I've been going to. But the sort of non-in-person, the sort of online stuff has been amazing as well. So like you mentioned, we met through LinkedIn, and this opportunity has come up because I just post regularly, and you happened to see that one day and you thought, this is interesting. So I think that I cannot believe the opportunities that have come from just posting regularly and being honest on there and commenting and reaching out, because yeah, and I think what's also good about LinkedIn is that we all recognize it's a professional platform and that everyone's there to grow and get business and get clients, as much as it's not always focused on growth in business. It's just sometimes it is just making connections and friends. But yeah, the opportunities that have come from that have astonished me. I can't believe the number of cool people I've met in the last year. And it just never would have happened. I would have been stuck on 200 followers and it wouldn't have grown, and I wouldn't have met everyone. I wouldn't be here doing this. I wouldn't have done the podcast I did last week. It's just the value of just getting over that fear and just doing it and being honest and being yourself in public. You start to create your own network of people who like you and who have your values. And I think that's where it gets into like niches and serving the people who you're best positioned to serve. So yeah, that's a long rambling answer to your question.
Oh, but it's a fantastic answer. And let's almost talk about, getting into that niche and finding the right people. But that's because you're interested. You're happy about what you're doing. You're interested in what you're doing. You're engaged in what you're doing. So you find and attract the right people. The connections you make, not wanting anything in return, going in with gratitude if you get anything. And I recognize that as well, because I think some people go about it, they're like, right, what can I get? What can I get? What can I get? Actually, when you are willing to just allow information to be given to you and take up information, it's a very different perspective to have.
Mm.
And when you start making genuine connections with people because of that commonality with thought, with the niche that you're in, it explodes. Absolutely explodes. They say, we've managed to connect just because of that. There's no sales angle here. It's just a connection to help each other. And I think that's so nice. And that's the bit that people miss when they exit a career, because they think that it's all just going to be salesy. Someone's going to give them something. They're going to have to give something. It can feel very transactional, and it really doesn't have to be. And it's interesting. You're right. When you work in health in a hospital environment, there's always going to be those people that you can pick up the phone to and say, can you just do me a favor? Can you just fast stream those results? But what you're doing is just building that network. Someone said to me years and years ago, when you're at school, you need to keep two people happy, the caretaker and the dinner ladies, because they're the ones that will help you out moving forward.
Yeah.
Extra dollop of gruel on your plate. That's, the dinner lady. And when you make a mess. So I think that's just the way you have to go about it, but I have to be willing and open. And the other really important thing that you touched on there was how willing people are to help. Because when you leave the safety of employment in any industry, it's very lonely. It's very isolating. Being self-employed is the best thing ever. But when you're sat, just you, at your laptop, with no one else to rely on, no finance department, no IT department, no HR department, what am I doing? How does this... who do I turn to? Yeah, ChatGPT is great for certain things, but not sure it's necessarily the best HR or financial planning platform to use. But people are willing to help because we've all been there. Yeah. And everyone, as you say, is at a different stage. And we all know what it's like to be completely overwhelmed because you've got no idea what direction you are going in, where to turn, something's not working. Right, that's it, I quit, and failing miserably. But there's always someone just to help you step back. And I love it. I'm so grateful to so many people that I've actually met on LinkedIn, never met in person, but we have a great relationship online, who I know I can just tap up a message to and say, I'm really struggling. Please, can you just give me something? And it might be anything. Really deep, great advice, or it might just be a slap in the face that you need to go, get a grip. You're doing all right.
Yeah.
Just get on with it. Stop panicking. Calm down, move forward. And then I think and then those in-person networking events as well. People are willing to help. Yeah. And I think finding the right network for you and that works is actually the key to all of that. Like anything. And again, you mentioned earlier, you got to find that tribe. It's not really a phrase I like very much, but it's true. You've got to find where you fit, because that's when it all starts to make a bit more sense.
Yeah.
Moving forward.
I think,
sorry, carry on. No.
I think a couple of things I'd say. I think healthcare is very zero sum in that, it's your scan. You're trying to get ahead of the other person's scan from surgery or whatever it is. And when we're used to kind of a resource scarce environment, you're very conscious that everybody is stretched and that people aren't super generous because they've got nothing left to give. And so I think when you go into the business sphere, having that ability, like Stephen Covey talks about, thinking win-win, it's like there's so many opportunities that don't cost other people that much, but are of real benefit. And there's even things that you can do for other people, or connections people you can introduce them to. And there's always some way you can add value. You might not think it, but for example, the other week I connected someone to a networking group which does events, and they're an event planner. Look, here's this. That might help you. You might get some business off of that. Like, it didn't cost me a few minutes, but you want to be generative. We're all in this to help each other grow. And getting rid of that restrictive, like, there's not, I suppose it's like a scarcity mindset, is really key. There was a second point. What was it? I was trying to think of it. You were talking about the hospital, and now I can't remember. I'm sure it will pop back to me
That's fine. We
at
can
a
come
poor
back to it
moment.
any time.
Yeah.
I think it's almost going, and it sounds wrong, but you're almost going from selfish to selfless, which sounds crazy when you talk about healthcare, that you should be selfish. But you're right. I want those tests for my patient now. And actually, what it really boils down to is actually you've got a massive target on your back because you've got to get that patient out of A&E, for example, to a ward, discharged, move them on, cut that off. You are going
It's
to
all the
fight your own
pressures.
corner. And everyone in their own silos is fighting the same pressure. The doctors in A&E are fighting, but the radiographers are fighting. Everyone else has got their own little bit. So, yeah, it's it's hard, isn't it? I think when everyone's fighting that, but just come out of it and see how best to do it.
It's the idea of being truly following your interests and your values. Because I think one of the things that people are most scared of is like rejection and getting into a crowd that they don't feel that they fit into. And I think something I'm so pleased I've done is coming into it with that, knowing what I'm here to do and what I'm interested in, who I'm interested in working with, because there's nothing worse than making the effort to do something new, putting yourself out there, feeling vulnerable and being like, I do not feel safe here. This isn't my bag. I'm not interested in the attitudes that these people have. So, and I think if there's anything I would say is just genuinely be yourself and be very true to that. And because that's the only way you'll find the people. So if you get rid of the facade of, I want to be everything to anybody, then nobody actually connects with you. They connect with this idea of you that you're trying to protect and project. So if you can drop the mask completely and take the fear and be like, right, I'm going to be bold. I'm just going to be myself. I'm going to be honest. I'm going to say what I think. I'm going to pursue what I actually care about, and not thinking about business and not thinking about, will this get me clients? Just because that all comes. It's just, who are you trying to be with? Because they will come if you put yourself out there, because we're all attracted to people who are like us and suit us and have similar values. So that's one tip I would say that I think has been so helpful for me.
Thank you. I think I can almost stop the podcast there, because what you've just said is absolutely just so important for people to understand and know, and to help them grow and move forward. You've absolutely hit the nail on the head. And I think part of the reason people struggle with that, especially from a healthcare background, is rejection and failure in healthcare have dramatic consequences. Let's be quite blunt about it. Patients die when failures occur. Not always, but that's the ultimate crux of it. When you're in business, if you fail, you just have to get up, get on with it, move on to the next thing. If someone rejects you, there's someone else. But you have to build those connections. You have to, as you say so rightly, find the people, do what you want to do and what you're passionate about. And that just makes the rest of it all fall into place and so much easier. I think that's really, that's a really, really key point. I want to move on and talk about the financial bit, because I think that's obviously your area of expertise now. and the bit that stops people moving and changing direction. Is it possible for healthcare professionals to leave healthcare without taking a huge pay cut long term?
Long term, yes. I think obviously it will completely depend on the area you're aiming to go into. I think if I'm not mistaken, I think you had a conversation with someone a few episodes ago, and they were talking about how what they're surprised most about is that they're spending less money because they're much more satisfied in day to day life. So you don't need the all inclusive holiday or to go skiing or the nice new car when you're actually much more satisfied with the work that you're doing. So there's definitely, even if you never earn more money than you did before, it might be that you actually don't care and that you are much happier
Yeah.
earning less because of all of the extra benefits that come with being in a career you're aligned with. So yeah, that would be my summary of your question.
Yeah. Well, first off, thank you for listening. You're the one, so that's good. Bonus tick, excellent. And you're right, and I know exactly who you're talking about. And it's so important it's almost that status thing as well, where when you lose some of that status, or at least thought that you have that status, actually, you don't need to compare that you don't have a chalet in the Swiss Alps and jetting off to Monaco for the weekend or the all-inclusive. Yeah, absolutely right. I think yeah. And you have to look long-term, which I guess is where financial planning comes in. What
It
advice would you
does.
give to healthcare professionals about long-term financial planning when they look to exit their career?
Well, I can certainly talk about what I did and my experience of that. So I think both my wife and I are quite frugal people and quite content, and we started saving quite early, even when I was still in medical school, and we were just relying on her wage. We lived in a really rough area of Bristol in a really horrible, dingy little bedsit that I still hate to this day, but it afforded us the ability to save. And so when we came up to Sheffield, when I started working, we had in that first year, 18 months of me working, we kind of kept we didn't let our lifestyle inflate too much. And actually, we saved quite aggressively. And that afforded us the opportunity to buy a house down the road, actually on the same street that we were renting on. So I think a universal law as pretty much is spend less than you make. And that's certainly something that we did. And then my interest in personal finance started to develop in those early years of my career, and I started reading lots of books on it and saving extras, and started to learn about investing and doing that in like low cost index funds. And I just found it super duper interesting. And then as soon as I saw, well, I'll tell you, it's funny, my first ever investment was in the S&P 500 in, was it April 2020? So that was the bottom of the massive dip that happened in the markets because of COVID. And I think in some ways it was probably the worst time ever for me to invest, because what happened, as we all know, hopefully, is that it recovered very, very quickly. So I basically bought the index at like a 30% discount. And I think that moment I was like, oh, okay, it actually works. Like you just put money in regularly over time, and things compound. Like obviously it's always up and down and it's never guaranteed, but just seeing it in practice, I thought, oh wow, this is amazing. And then I started locuming, so we had more money to spare, so I just did more of it. And eventually we ended up in the position where we were very deliberate about our spending. Lifestyle does inflate, I think, unless you're very, very deliberate about cutting it back. It
Yeah.
does. And I think we watched a documentary on FIRE, Financial Independence, Retire Early. And I think that kind of cemented the idea in my head that for both of us, actually, the most important thing to us, and again, it comes back to values, is what are you spending the money on and why are you spending the money on that? And actually, so much about financial planning is being clear about what's the purpose of your life, what's the purpose of the spending. And so for us, it was very much like we'd rather have options, we'd rather have freedom than we would a flash car and a bigger house. And I'm so pleased we did that and we made that decision. because otherwise I wouldn't be here. I wouldn't be talking to you, whether I'd still probably be in medicine and perhaps even worse. So I think having that buffer that we did and those investments that we did, that was the lifeline. That was the opportunity because, as you say, everyone's got bills to pay, they've got obligations. And I think I also saw some close family members go through a very difficult financial situation where they were earning very, very, very well and still had nothing. They still had no savings and they had to sell their house and all sorts of chaos was going on. And I think for me, that moment was like, none of that matters if you're stressed out your mind and you can't sleep at night because you're worried, can I pay the mortgage or not? And I guess that's kind of why I talked about that point earlier is there's so much more to it than just the money. Your experience of life is what you're going to take to your grave. And you
Yeah,
don't want to live in a
absolutely.
very nice house and be miserable and worried and stressed. So that was almost a philosophical level thing for us, which afforded us the ability to have a surplus on purpose and the whole pay yourself first, automatic savings, automatic investments, dollar cost averaging or pound cost averaging, I suppose. You can tell where I invest.
I'll be
I
asking for
think
tips and tricks offline.
so. It's having that discipline over time and you see it work. I think that's the thing is that we're a very cautious culture in the UK. We don't actually invest very much. We hold a lot in cash. We kind of the only thing people see as a good investment is their primary residence, or maybe they try a buy to let. So I think for me, it was just learning those things for the first time, doing them, and then seeing that they actually work. And you're like, oh, this thing actually works. It it went up in value after 5 years of me leaving it alone. And like I say, it's all tied up in the meaning. That's the only way I would have done this.
Enlightening to hear and so good to hear. And I think you touched on a point there that here in the UK especially, we are probably fairly risk adverse. Financial planning as a whole, I don't think comes very naturally to us. We're not taught about finances in school, going right back to education. It's not something is done. It's just kind of brushed over. And yeah, you're right. Houses are the best thing you can do. We won't even get into that because there's a massive myth there, I think. But that's a whole nother episode. And I've got some great people on LinkedIn actually they've started something called the Cash Academy, which is teaching children financial literacy. I think that then is a building block for everything moving forward. Why do so many clinicians and healthcare professionals, do you think, underestimate what they can earn outside of healthcare?
I think it's partly that demoralization, institutionalization thing that we discussed on earlier. But I think, to be honest, it's just not having any idea of what else is out there. Certainly, that was my experience. Is I could not believe how interested recruiters were in me. Like I was
Yeah,
like, oh my gosh, why are all these people asking me questions and saying, oh, I've got this opportunity and that opportunity? And I think value is a kind of a proxy for your pay. And if in your own mind you don't value yourself very highly and you kind of go, well, this is all I can do, it's all I'll ever do, that's the only option, you kind of just say it's a decent enough wage, especially once you've CCT'd and you're a consultant or a GP. So you sort of settle for that, maybe. I mean, some people love the job and that's fantastic. But I think there are a cohort of people who they're just there because they can't imagine a different opportunity out there and they don't know what else there is. But you look in the health tech world and all the stuff that's going on in AI and pharma, there's so much opportunity and people like big companies are always looking for talent. So you just don't know how good it can get. And I think that's the other thing is there's caps on pay. There's a scale and it goes up and then you reach the top of the scale and it's not going to go any higher. Whereas in business, especially if you're self-employed, you don't know how high it could go.
uncapped
And obviously
completely.
there's risk with that, but
Yeah,
yeah.
yeah, absolutely. I think it's probably a good point to give a massive shout out to all those people in healthcare and any career, any sector, who are happy in their job.
Yes. Good.
Sometimes I often feel like I'm kind of just like bashing everybody in work. and careers and everyone must be unhappy. There are many, many people who are very settled, very happy, enjoy their lot. And that's great. And thank goodness. And I always use the example when I left clinical for the second time, there was a therapy radiographer, and I think she was retiring after 30 plus years doing it. Hats off. Thank you. I struggled after second year of uni. I knew I wasn't going to do it forever. You know, there are people who are who are happy and will continue. But I think you're right. There are the myths around what it's like to work in the private sector away from healthcare. The earnings is a really interesting one, and you're spot on about that cap potential because you are limited, and the stress of having it all. You become a consultant and everything that comes with that, and the lifestyle that you are expected to lead. Step away, and it's something very different. What are the biggest money myths that keep doctors and healthcare professionals, do you think, stuck when they have outgrown a role?
I'm not sure. It kind of comes back to your point about the level of education in finances and in business, that the baseline level of understanding of the average person in the UK is, I think, really, really poor. And not as a slight on anyone. I think that's just kind of, in some ways, the way the system is designed to work. So I think, what would I say? I think getting a basic level of understanding of the way the financial system works, like how does a credit card work, and how does the interest on that build up, and what's the real cost of that over time. Even everyone has a mortgage, or most people have a mortgage at some point in their lives if they're in healthcare, especially if they're a doctor. How is that interest charged, and what's the impact of that long term, and how is the loan structured? Student loans, I think what I'd say is a lot of our whole economy is kind of a debt-based economy. And so if you can understand debt, and at least in a basic level, you've kind of got a concept of mortgages, loans, bonds. It's all debt. And understanding that is super important to understanding how things work. And then I think also understanding how interest compounds and how growth compounds, because ultimately it's the same principle, just reversed. So compounding levels of debt and compounding levels of assets are the same thing, just two sides of the same coin going in a worse or better direction. In terms of myths, I'm not sure, because I think because I'm in this profession and because of all the interest that I had in it, I actually came into a lot of this knowledge off my own back, and because I really was interested and cared about it. So I don't feel I'm well placed to sort of know what the average doctor's experience of money is, because I was weird, if that makes sense.
Yeah, I wouldn't call it weird at all. Interest.
Yeah.
Ultimately, that's what it's about. You found your interest and you had that interest, and that's, absolutely the right place to be. So I appreciate that. All right, so let's strip it back basics.
Yeah.
I guess kind of to sum up and to look at ending. If someone is facing that time where they feel so stuck, they've outgrown the career, or even actually looking at redundancy, because obviously that's a huge thing happening right now across the NHS, across NHS England. People are looking at that redundancy. What do you think should be the first financial questions that they should be asking themselves as they look to exit?
I think everyone needs to know what, on a basic level, they're spending and what they're taking in. But having a budget, having a basic idea of what you're spending, because I think it surprises a lot of people. And I've been surprised in the past of, like, oh my goodness, where did that subscription come from? I'd forgotten about that. How long has that been going through? I mean, even a couple of months ago, we realized that we'd been paying for an additional phone contract, like a SIM only contract, that we were like, when did this get set up? And we were both looking at each other trying to work it out. So I think it's amazing how much money you can save if you just tighten things down a bit and look at where the money is going, and then having those conversations with yourself or your partner about, why are we doing this, and is it important to us? I think we, unless we have a clear idea of what we're doing and why, we adopt the default settings. And I think one of the most helpful things is going to your values and seeing how that reflects financially. Spending most of your money on a very small amount of things which are really important to you, and just scrapping the rest and just getting rid of it. And having a surplus is so important, especially going into a period where you're likely to not have an income. I think it's one of a key parts of financial planning is having an emergency fund of a pot of savings in cash of 3 to 6 months, we generally say. And it might be longer depending if you're self-employed and your income is choppy, you might want it longer, up to a year even. So if you're not forced out at some point, and if you're just thinking about it, I think being prepared financially essentially is kind of like an emergency. It's like, I don't want to do this anymore. I need a way out and I need to plan it. I was odd in the sense that I'd already come up with that plan and committed to it, and we had the buffer there already. So at the point that I jumped ship, it was okay for us. If you're not in that position, that's a much bigger risk. And I think having an emergency fund is a really important part of that process. And also, you don't have to necessarily jump all at once. I know a lot of people who have maybe dropped their hours at work and then commit to building up that side hustle into something that's permanent. So I think it's just, obviously I can't give any specific advice, but I think it's really about knowing where you are financially and having a really clear picture of that, knowing what you really care about, what direction you're aiming in, and how can you practically get there, and being very precise about those details, because the vagueness is, I think, where people kind of get trapped. If you just start burning money and you think, oh, okay, I have a lot less left than I hoped for, and that's when things can get a bit scary.
Yeah, absolutely.
Yeah.
Thank you. When I work with my clients, as we alluded to earlier, one of the kind of the third step that I look at is the affordability of it. And I talk about minimum viable income. What is it you actually need to get through on a day-to-day basis, minus your cost of coffees, minus your lunch, minus your takeaways, minus the subscriptions. So what's next for you? What's the plan over the next 6 months to grow your business, and where are you hoping to be?
So financial planning is a bit of a tough gig in the early years. It's a hard system to break into. So really it's just focusing on building the business as much as I can. So I'm mainly focused on healthcare, doctors. My ideal client is kind of an entrepreneurial doctor, because that's what I've done. I've jumped ship completely. I'm doing something completely different. And I think, again, it's about being honest about who you are and what you care about. And I think that story means a lot to people who have also done it. So I think it's just really putting myself out there as much as possible, posting as much as I can, making the most of opportunities, connections, trying to get some of my first clients in the door, and growing that organic business through referrals and testimonials. And so my vision very much is longer term. I want to kind of create a community of entrepreneurial doctors and add value beyond the advice that I'm giving. And to say, I don't know, if a client is thinking about, I don't know, getting a divorce, I know a divorce coach, or I know some good lawyers. Or if they're thinking about getting into shape, I know doctors who are basically doing PT as well as being a doctor. And I know people who are in marketing, and it's about adding the value to the community in total and creating a group of people that are there to help and support each other grow. So yeah, that's kind of my vision, my hope for the next 6 months to a year.
Amazing. And community is so important. In an ever-growing AI distanced world, community is going to come back and be so important. Luke, thank you so much for sharing everything about your journey. It's absolutely fascinating. And I hope people will take away so much from you, and clearly the hard work you've put in to get to where you are, but really overall that it is possible to make that change when you have a plan in place, and when really you know what you want to do and where you want to be and to connect with the right people. So, Luke, thank you so much, and I wish you all the very best moving forward with your business. And I know we will stay connected. And I think we've got some work to do together moving forward as well.
Yeah, no, thank you so much for the opportunity to be on here and share my story and a bit of my vision. So yeah, more than happy to help. Thank you.
Amazing. Thank you. Have a good day.